So I'll be presenting the last case. So this is a 17-month-old female with the intermittent high-grade fever for 2 months duration with low HB, high TLC, and low platelets. So we did a bone marrow. So we had a blast or abnormal promyelocytes 56%. And this is the morphology. So a better view. So most likely diagnosis, many of you would have guessed it. Yeah, it's like a acute promyelocytic leukemia. So the MPO is nicely strongly positive like in an APML. And the flow is also consistent with an APML with high site scatter and absence of CD34 DR. But we were planning to expecting a PML RARA. So the interface fish is not showing any fusion signal. The first one is the interface fish, which is not showing any fusion signal. And the break apart probe is not showing any break apart signal either. So we had it coming negative for PML RARA. So we ran a molecular test for both BCR1, 2 and BCR3. So they are also negative in the gel. So the qualitative molecular test is also negative. Now what happens is, so we concluded that the looks are deceptive. So it is an APML, but not an APML. Even the qPCR for sensitivity is also negative. So in the end, we ended up looking something in which we don't have a differential other than APML. We put it for the detection of fusion signals. So we got a fusion, which is TBL1 XR1, which is on chromosome 3 fused with RARB. So RARA or PML RARA, the retinoic acid receptor alpha is what is there in the common garden APML. This is retinoic acid receptor beta. So it is just like a brother or a sibling of the RARA and has similar morphology and patterns, but this doesn't respond to the conventional therapy which we use for PML RARA. So this is the final diagnosis was an APL like AML with TBL1 XR1 RARB fusion. So many, in addition to retinoic acid receptor beta, even fusions can be there with retinoic acid receptor gamma. So all these three fusions are considered part of the APL like spectrum. And if you are having a morphology which is very characteristic of an APML, but you're not getting any of your conventional molecular techniques or fish supporting the evidence, these sort of things have to be suspected. So with that, I thank the organizers for this event. So let's thank you all for your patient listening.